All right, in this week's Women's Care Wednesday segment, advanced registered nurse practitioner Sasha Persaud with Women's Care Florida joins me to discuss HPV, which affects approximately, listen to this, 80% of the U.S. population. That's crazy to think about. Good morning. Good to see you.
Good morning. Thank you for having me today.
So when we say this 80% of people being affected by HPV, you're saying that about 80% of us are going to be exposed to it at some point?
At some point. The way HPV, human papillomavirus, is spread is primarily skin-to-skin intimate contact. So sexual intercourse is usually what we look at as far as that goes. There are several different strains of the virus, and there's a vaccine on the market that covers 9 different strains that we offer. Most commonly, Gardasil is what it's known as. And that's what we offer to help protect against certain types of cancer. Cervical cancer is primarily the one that we look at most in OBGYN, but usually it can affect the vulva, which is the external female genitalia, vagina, and it's also expanding to be anogenital and oropharyngeal, which by next year will probably be the most commonly spread cancer.
Well, and what's interesting is I just feel like we're learning so much more about this than what we did, 5-10 years ago. I mean, at least I hope hearing more about it. We're hoping that there's more ways to prevent, cervical cancer and different kind of cancers. Is that the trend that we're seeing, even though that it's still so, it's out there so much?
You're absolutely right, Carly. We have learned a lot more about it over the years. The vaccines that were previously on the market, covered 2 strains, then 4 strains, and now 9 strains. So the best way to protect against cervical cancer is to offer the vaccine. Usually pediatricians can start offering this as early as age 11, age 12. Patients can start getting it as early as 9 years old, and that's for females and males.
Okay.
Usually, being part of Women's Care, we offer it to all of our patients. The research shows that, yes, it's good to have it before you become sexually active, but we still offer it to all sexually active patients as well.
And I know this must be hard for parents, certainly if, let's say, you have that youngest, 9 years old is the youngest that people are being vaccinated. What do you want parents to know? Because this, I think, does have to be a conversation, certainly if they're going to see their pediatrician. I mean, how do they approach this? What do you recommend for parents to know?
So in personal experience, being in clinical practice, a lot of the time parents have this misconception that it allows their child to have intercourse, which is not the case. We know that over time, sexual intercourse does occur over the lifespan. So we want to make sure that we're protecting our patients as best as possible, especially because males don't always show up with the symptoms.
Okay.
Cervical cancer, that's why we do pap smears, which starts at age 21 for females. And that's the only way that we can really detect it in terms of cervical cancer.
And I hope I don't embarrass myself by asking this, but is it females and males that get the vaccine? Is it just females?
Females and males.
Okay, so because they can both be carriers.
Yes.
Okay.
Yes. So a lot of the time, because males don't have common signs and symptoms that they show with regards to the HPV, then females can show with the cervical pap smear, so ages 11 to 12. And then there's different ways to dose the vaccine. So if they start getting it at 11 or 12, it's 2 doses, 6 months apart. If they start at age 15 and up, then they get a series of 3 doses.
Okay.
So they would get the first dose, come back a month or 2, get the second dose, and then the 3rd dose would be at the 6-month mark.
And you were saying that most insurance companies, not all, but it could be covered by your insurance company as well.
Yes, absolutely. So what we do in our office, for example, is that we have our staff just double check with the insurance company before we give the vaccine, but it is considered preventative care. So I would say that the majority of insurance companies do cover it, but I always advise checking with your individual plan first.
As we wrap up, what's your take home when it comes to this? And again, 80% is going to be exposed to this. What's your take home? What do you want people to know?
So very passionate about it as a provider. We try to offer it to all patients within age range, and that's up until age 26 for females at this moment in time, age 21 for males. There are certain exceptions with regards to the male population that they can get it between ages 21 and 26 years old, but it's something that's protecting our patients, and that's something that we're always going to make sure that we try to do for them, because that's our role as providers.
Well, thank you so much for coming in and getting awareness about this. I don't think we can do it enough, so we appreciate your time this morning. We'll obviously put the contact information to get a hold of Women's Care Florida as well, but we appreciate it. Thank you so much.
Thank you.